It's a proud privilege to invite our first speaker, Dr. Vipul Janardan, who is a consultant psychiatrist, and uh, right now he is having 12 years of clinical experience in mental health care and is active member of World Psychiatric Association Fellow, and he is active member of Global Psychiatric Association. He is having some important roles of some subcommittees of Indian Psychiatric Society, and he also published a book on understanding sexual dysfunction, a psychiatrist guide, along with Professor T.S.S. Rao. So with this introduction, I request Dr. Vipul Janardan to start his presentation. Over to you, Dr. Vipul.
Thank you so much for this generous introduction. So, without wasting time, in this era of war, I'm warmly welcome you and thanking you for taking out some time and bearing me here. And moreover, this is also a season of football, so everybody will be busy. So, still, without wasting time, thank you for Global Psychiatry Association, Dr. Reinhard, for giving me opportunity to speak on this important and timely topic. When we think about war, we often focus on the visible consequences: loss of life, physical injuries, displacement, destruction of the infrastructure. However, some of the most profound consequences are invisible. The psychological wound caused by war can persist long even after the gun falls silent and the physical reconstruction begin. Across the world, millions of people are currently living in the conflict affected region. We can't say across the globe that we are not in the time of war. Whether we are in the war or in the proxy war, or we are indirectly affected by the war. So we all the across the globe we are in the war zone. Having been displaced by war, these individuals face enormous psychological challenges, including trauma, grief, anxiety, and enormous psychological distress. As a mental health professional, million of people is affected. So it is our responsibility not only to understand the consequences, but also to develop active intervention that promote healing, resilience, and recovery. In this presentation, I will be discussing the psychological impact of war, the neurobiology of trauma, vulnerable population such as children, women, and evidence-based intervention that can help address mental health of the conflict-affected population. Ultimately, the goal is to understand how we can transform trauma-informed care into a meaningful action that support those affected by the conflict. Just So, learning objective of this understand the psychological impact of war, recognizing common psychiatric disorders, identify vulnerable population, and evidence-based intervention. Before discussing the psychiatric consequences of the war, it is important to appreciate the scale. According to according to the recent UNSCR estimate, more than 123 million people worldwide has been forcibly displaced due to conflict, violence, and persecution. This represents one of the largest displacement crises in the modern history. Importantly, nearly 40% of refugees are children, making them particularly vulnerable to the psychological effect of the trauma, disruption, and loss. These numbers remind us that the war is not geopolitical level issue, but also major global mental health challenges affecting millions of people. So in this paper, they say there is nearly 180 million people were displaced by the conflict and persecution. So whatever the number, whether it is 123 or 118, the number is huge. Behind these statistics are real individuals and families whose psychological suffering often continues long after the physical safety is restored. So what is the psychological impact of war? So this is a vicious cycle. It starts from the chronic uncertainty and fear. Sorry, it starts from the exposure to violence and death. There is loss of the loved ones, and there is displacement and migration. And then further, there is a breakdown of the social structures. Then again, chronic uncertainty and fear. And then again, this in a one way or directly or indirectly turn into the violence and death. And again, the war. So war affect mental health through multiple ways. Individuals are often exposed to violence, death, and life-threatening situation, which one can
Yes, please.
overwhelm normal coping
Sorry,
mechanism.
I'm in a lecture.
Many
No, it's
experience
fine.
that
I'm
the
just
loss of the
explaining
loved
why
one,
I'm so hard of
homes, and the
hearing.
communities, leading to the profound grief and the emotional distress. Displacements and the forced migration further increases the stress by disrupting social support system and the certain uncertainty about the future. At the same time, war often result in the breakdown of the social structure, including healthcare, education, and community network. Together, these factors create chronic fear and uncertainty, significantly increase the risk of PTSD, depression, anxiety disorders, and other. So, what are the common mental health disorders? We all know PTSD, depression, anxiety, substance use disorder, complex trauma and grief. And long term, there is change in the personality, substance misuse, suicide risk. These are all things. In the one of the recent, when I was preparing this slide, I've said this one of the recent analysis in the Lancet. It was published. There's 24% of people in conflict setting have a mental disorder, with about 9% experience moderate to severe condition. So this is a huge number. We can estimate the gravity of what war can do. That. So PTSD in the conflict setting, this is the signature disorder that happens after any war. A lot of people suffer from this. So it is characterized by intrusive memories and nightmares, hypervigilance, avoidance behavior, emotional numbing, and functional impairment. Children and adolescents are most vulnerable victims of armed conflicts. Exposure to war can disrupt critical stages of emotional, social, and cognitive development. Separation from parents or caregivers, or may impair attachments and create feeling of insecurity and abandonment. Conflict often interrupts education. It deprives children of stability, routine, care, and opportunity for growth. Many children develop behavioral problems, including aggression, withdrawal, emotional dysregulation, and difficulty in concentration. Importantly, adverse experience during childhood can have a long lasting effect. It can stay with them till their life, increasing the risk of mental disorders, also like PTSD, depression, substance use, and other form of psychopathological later in life. So early identification and intervention are therefore crucial to promoting resilience and healthy development. Women and vulnerable population often face unique mental health challenges during the war and armed conflicts. Gender-based violence, including physical, emotional, and sexual abuse, frequently increase during the period of the war and displacement. Survivors of sexual trauma are significantly higher risk of developing PTSD, depression, anxiety, and complex trauma-related disorder. Pregnancy and motherhood during conflict bring additional challenges, including the limited access to the healthcare, increased stress, and concern for the safety of the both mother and the child. Woman also assumes difficulty in caregiving, responsibility for children, and injured family member, adding to the emotional burden. Furthermore, social exclusion, stigma, and the economic hardship can compound psychological distress and hardship and hinder access to support and treatment. Refugee and an internally displaced person. Refugee and internally displaced person face conflict, mm, both internal and external, have multiple stressors that extends far beyond the initial trauma of war. Many many experience acculturation and stress that adapt to a new language, culture, social environment, uncertainty about the legal status, economically weak, and no monetary gain. So these are the things that happens, and poverty and the unemployment further contribute to the psychosocial distress, while isolation and separation from the family members can worsen feelings of loneliness and helplessness. Access to the healthcare, including the mental health services, is frequently limited to by financial, linguistic, and the administrative barriers. During my residency training in Delhi, working in hospital, so I had witnessed and had opportunity to interact with several Afghan refugees. Many had fled conflict and experienced significant losses. Despite reaching a place of relative safety, they continue to struggle with anxiety, trauma, memories, uncertainty about the future. And despite the adapting to the new environment, their experience reinforced for me though the psychological impact of war often continues long after people leave the conflict zone, and even the medicine and the pharmacological measures does not work well as to the other patients. So neurobiology of trauma, I don't want to go in the detail of that, because we all know HP axis dysregulation and amygdala hyperactivity. There is hippocampal changes and there is altered stress responses, and on the top of it there is a epigenetic influence. In PTSD, the amygdala become overactive, the hippocampal shrinks, and the prefrontal cortex loses some of its regulatory control, leaving the brain stuck in the survival mode. So, effective, this is slide of assessment in the conflict zone. So, effective assessment in conflict zone requires more than the symptoms identification. It requires understanding the person's trauma, culture sensitivity, and safety and the community context. Assessment in conflict setting requires a trauma-informed and culturally sensitive approach. Many individuals have experienced severe adversity, and it is important to create a safe, non-judgmental, neutral environment that promote trust and disclosure. Cultural sensitivity is essential because the expression of the psychological distress varies across the different communities and culture. A comprehensive assessment should include evaluation of the trauma exposure, providing the safe space, current symptoms, functioning in the social support, and immediately safety concern, including the risk of the self harm. suicide, or ongoing violence. And standard screening tool like PCL5 for PTSD or PHQ for depression and GAD7 and other tools can be helpful. They should be complemented with the interviews and other things, not replaced with the clinical judgment. Community engagement is equally important. Working with community leaders, local healthcare workers, teachers, and families help improve of mental health needs, reduce stigma, and facilities access to the. In conflict settings, assessment not only about the diagnostic illness, it is also about the understanding of the individual need, social and cultural and the environmental context. So management of trauma-related mental health problems requires evidence-based intervention. Psychological first aid is often the first step, focusing on the safety, support, and the stabilization. Trauma-focused cognitive behavioral therapy helps individual process traumatic experience and develop healthier coping mechanisms and strategies. EMDR, eye movement desensitization or destabilization and reprocessing, is an effective treatment for PTSD by facilitating adaptive processing of traumatic memories. Narrative expressive therapy is particularly useful for refugees and the survivor of multiple traumatic events. Pharmacotherapy, especially SSRIs, may be useful when the symptoms are severe or when comorbid with depression and the anxiety are at present. When individual treatment is important, sustained recovery is conflict setting requires community-based approaches. Strengthening resilience, help individuals and the community adapt and recover from the adversity. Peer support system provide emotional support, resilience, and reduce isolation and foster a sense of bonding and also the belonging. School-based programs are particularly important, and it helped to increase awareness, reduce stigma, and access to the services. Finally, capacity building through training of the local healthcare workers, teachers, and the community leaders ensure that the mental health support remain available in resource limited setting. These approaches help create resilient community capable of the supporting long-term recovery. Healing after war is not just an individual process. It is a community process that requires resilience, social support, and local capacity building. Coming to my next slide, role of a psychiatrist, or better say mental health professionals. Psychiatrist or any mental health professional play a very strategical and critical role in addressing the mental health challenges as a consequences of the war, provide clinical leadership through assessment, diagnosis and treatment of the trauma related disorder. Capacity building is equally important, involving the training of the primary care providers, community workers, and the mental health professionals. Psychiatrists also contribute to the policy advocacy, promoting the integration of the mental health into the humanitarian and the public health responses. Through search and research and monitoring, we generate evidence to guide effective intervention. Finally, the collaborating with the psychologists, social health workers, nurses, educators, and the community organization is essential for the comprehensive and the holistic approach to combat with this mental illness as a consequence of the war. Psychiatrists are not only clinicians but also leaders, advocates, research, and the collaborators that help in the mental health response to the conflict. Providing mental health care in conflict setting is associated with several challenges. Limited resources often mean inadequate funding, infrastructure, and access to the essential medication. Stigma surrounding mental illness may prevent individuals from seeking help. Many conflictive regions, affected regions also face several shortage of the trained mental health professionals, making more things more vulnerable and more making more challenges. So such as additionally clinician frequent encounter ethical dilemmas such as balancing these challenges requiring coordinate effort from government, humanitarian agencies, and mental health professionals. The need for mental health care is greatest in conflict setting. Yet these are often environment where delivering care is most challenging. Looking ahead, innovative approaches will be essential to address the growing mental health needs of conflict-affected population. Digital mental health platform and the telepsychiatry can expand access to the particular needs in the remote area and in the remote resource limited settings where the individual or the psychiatrist or the other human services are not allowed or cannot be reached. Task sharing models where the trained communities health workers deliver the basic mental health intervention under special intervention under specialist supervision can help bridge workforce shortage. This is also growing emphasis. There is also growing emphasis on developed trauma related healthcare education and social system. NGOs and role of NGOs and the academic institutions and the local authorities play an important role here. So when the war ends, the rebuilding of city begins, but the rebuilding of mind often takes much more time or much longer. As a mental health professional, we must ensure the invisible wounds of conflict not forgotten. So looking ahead, these innovative approaches will be essential address to the growing mental health needs of the conflict affected population. Thank you very much.
Thank you very much, Dr. Vipul Janardan, for finishing the